I'm Dr. Weiner, and what I'm going to show you right now is Dysport, which is a neuromodulator. It's similar to Botox, but it's not Botox, it's Dysport. And what it does is help relax the muscles that create wrinkles. So it's given in injection form. It's FDA approved to be used in the glabella area, which is the frown line, but it's very commonly used by almost everyone in the crow's feet, brow lift, and in the forehead area. Those are the most common areas, but it could be used in this area here to help improve the corners of the lips. It's called a DAO injection. It's also used in the masseter area for people that have large masseters that grind their teeth. You can help relax that muscle. It also slims the face by injecting that area. So you can also help with a gummy smile by injecting right here. It helps the very gummy person to become less gummy. So I've been doing this for over 25 years, or over 20 years, I'm sorry. And so it's a very simple injection, but it's not that easy for all docs. So you got to be careful who you go to. So anyway, so she's already been wiped down with alcohol. I'm going to start injecting here in the glabella area. You can come in a little closer. And I'm injecting, that's called the procerus, and then over here it's the corrugator muscle. Okay, and you should have very little bleeding or bruising with the injections, and then I inject the tail of the corrugator over here. Okay, so that's the typical injection for the frown line. There's 5 injections, 1, 2, 3, 4, 5. Now I'm going to go to the crow's feet, and let me turn towards the camera here. And the crow's feet is caused by the orbicularis oculi, and so we relax that. And we do a series of 4 injections in this area. Okay, and that's 4. And then we go to the other side, and we'll do the same. So that's the crow's feet. So that's pretty easy. And then what I like to do is I also do the forehead. And see, we go up here, and there will be a series of very small injections up here. And so what happens after the injections is around a few days later, you start to see them kick in, the injections. Okay, raise your forehead. All right, so we'll do a little bit more, and we're done. Okay, so the injections kick in 3 or 4 days, and then they'll end up lasting for about 3 months. So she'll be wrinkle-free or significantly improved with her wrinkles for about 3 months. Very similar to Botox. Dysport tends to kick in a little bit sooner than Botox and maybe lasts slightly longer. I use more Dysport than Botox, but they're both very similar. There's also a third one called Xeomin, which I don't use very much, but its dosing is very similar to Botox. The dosing with Botox and Dysport is different, and so the doctor has to be comfortable with that, and it's not actually a conversion. It's anywhere between 2 and 3 times the dosing of Botox to use for Dysport. I've been using Dysport since it's been FDA approved around 7 years ago, but Botox for over 20 years. So that's about it. That's a very simple injection using the Dysport. If you have more questions, give me a call, 850-622-1214.